Hi, I'm Evelina.
And hi, I'm Henna.
And this is our introduction of the team. So, we are third year midwifery students from Finland, and I'm 22 years old, and Henna is 23. And we are both doing in total of 12 weeks of practical training this spring, so we are very busy and we have this tight schedule that needs a lot of planning. But it's manageable with good team and communication skills.
Yeah, and the other two members of our team are Dutch students, Kitty and Lotte, and they are both third year nursing students, both 22 years old. And Kitty finds elderly care very interesting, and Lotte likes mental health care, which actually I like too. Even though I'm gonna be a midwife, but if I wasn't, I would probably do my expertise in mental health care. So, Kitty and Lotte have both done their internship in Tanzania, and that's also why it's interesting for them to do a research about East Africa, and you will find out the subject a bit later. And at the moment, they are following the minor about cultural care.
Yes, and a brief description of the collaboration agreements we have. So we are working and communicating mainly via WhatsApp and also a little bit Skype. And Kitty and Lotte have planned this schedule for us for this spring, which has some flexibility in it, which is a good thing because we have these different tasks and things to do this spring, and in addition to this project. So yeah.
So it's really important that we have a flexible schedule so that if something comes up that we can work the schedule.
Yeah. And we have all agreed to follow the planning schedule, and we have agreed to let each other know if we have these potential obstacles or any other aspects that might slow us down in this project. And yeah.
Then some expectations related to the benefits and potential risks of working together at an international level. And some potential risks that we thought about. The first one was the language barrier, since obviously none of us are speaking English as our native language or even as
second language.
Yeah, basically, yeah.
Yeah.
So that's obviously one thing, and scheduling is the other thing, as we said before, that we all have so many things to do in addition to this project that it's really important to schedule our tasks and have like a timetable that we're following with this project as well.
Yeah, and we have this only 1 hour time difference, but it makes a difference.
Yeah, especially in the night time and with our training schedules and like practical training schedules and all that. So it's an hour is not much, but it makes a difference sometimes.
Yeah.
Then there's communication. One potential risks. It's kind of linked to the language barrier, I think. And also one risk that we thought was the understanding of the task, since it was a bit unclear at first what will the outcome of this project be, and I can say from our behalf that we were really confused in the beginning that what we're supposed to do this spring, but thanks to Lotte and Kitty, now we know what we're doing and it has been great. They have helped us a lot, and I think our teamwork is going pretty well at the moment.
Yeah. And the benefits of our team, so we get to work in an international team, which is nice, and our subject is very interesting and important, especially because abortion is very close to us midwives, and yeah, and it's always nice to get to know new people, especially in an international level.
Yeah.
And this is a great opportunity to improve our communication skills.
And of course our language skills as well, because as said before, English is not our first language, so it's nice to improve that as well. And we haven't used it that much in our studies before. I don't know about Lotte and Kitty, but we haven't that much, so it's good to improve it now.
Yeah, and this is a great learning opportunity about an international project and how things are made, and so
yeah, so we're really looking forward to this, and especially what will the outcome be, so thumbs up.
Hi, my name is Lotte and this is Kitty.
And this is our sales pitch in 3 minutes.
Our research question is: how is it possible to reduce unsafe abortion in East Africa based on Scandinavian standards?
We gave answer to the 5 W's, which describes our research very shortly. The first one is who: healthcare providers, volunteers who work in East Africa, and East African women.
The second one is what: reducing unsafe abortion. This also including saving lives, promoting healthcare and sexual health.
The third one is where. It's in East Africa using Scandinavian standards, and this also includes legalization, laws and regulations.
The other one is when, before and after pregnancy. This also includes preventive care.
The last one is why, to increase knowledge and reduce unsafe abortion and promotion of healthcare.
There are a couple of sub-questions which belong to our research. One of them is: what are the differences and the similarities between Scandinavia and East Africa when you talk about abortion and unsafe abortion?
We also use what are the causes of unsafe abortion and what do we mean by unsafe abortion.
The added value of our research is for Scandinavia way different than for East Africa. For East Africa, our research is very useful. With the information we have collected, the healthcare can use the advice from Scandinavia.
First, care must be improved, and later the number of unsafe abortions could go down and lives can be saved and health and sexual health can be improved.
In Scandinavia, volunteers and employees can benefit from our research. It is not about saving Scandinavian lives or improving Scandinavian care, but it's to guide the volunteers and employees who want to work in East Africa.
In our project you can see a clear comparison between Scandinavia and East Africa. With this comparison we make it possible to fill in weakness with strengths.
We mainly use Scandinavian articles because these are more usefully than the Dutch database. Because these are more in English and our database is more in Dutch.
We're going to use the National Institute of Healthcare and Welfare, KILA, and Europecitat.com as Finnish databases.
We're going to use Google Scholar and PubMed as Dutch databases, and we are also going to use the website from UNICEF, AMREF, Flying Doctors and Artsen zonder Grenzen.
There are different research sentences we're going to use. For example, unsafe abortions and East Africa and abortion and Scandinavia.
We use also synonyms for abortion, for example, pregnancy, termination and miscarriage.